Planning is a silent station and it's for 15 minutes. At this point, you're not going to be using a light patient here. You're just going to be sitting down with your pen and notes. You're going to be using a black pen, which will be provided for you, or it's good you come with your black pen, unlike the assessment where you use the green pen. There are some essential qualities that are important in planning, which includes be patient-centered. Your work must contain the actual work of nurses, including education and psychological support. Your work must reflect the objective and clinical judgment of the nurse. Your work must be logical and sequential. It must be written as the event occurs, and record of variances in care must be ensured. That is in planning. Sample care plans includes post-operative care plans, which could be pain, safety preparation for theater, pre-op. We have post-operative care plans, which could also be pain, risk of respiratory irritation, risk for hemorrhage, risk of infection, risk for fall. Care plans for stroke patients, that's risk for malnutrition, risk for aspiration, unable to feed self, impaired mobility. Care plans for asthmatic patients might be shortness of breath, activity intolerance, risk for aspiration during asthma attack. Planning paperwork. In your documentation is made up of the following columns. There's a column which will include your patient detail, and the first one we are going to write the nursing problem or the need or activity of living. The second column will be the aims of care. The next will be the re-evaluation dates. Then there will be a column where you write a care by the nurse and self-care. There's a place you will need to print your name and the nurse signature and dates. And there will be like 3 pages. You can, in Nmc Osce, you need to just write 2 nursing problems and give your nursing give the care by a nurse. But there's a third page in case you make a mistake, you can just cross through and write on the third space. An example of care plan of pain post-operatively. The nursing problem, which is Mrs. J is experiencing pain due to recent appendectomy. Aims of care. Mrs. J will state that her pain is manageable and will have a pain score of less than 3 out of 10. Re-evaluation of care. To be evaluated each shift or if a clinical condition changes. Care by nurses. Explain and discuss aspects of care to Mrs. J and gain consent for all interventions. Monitor, report and document Mrs. J vital signs for hourly. Observe for verbal and non-verbal signs of pain using the pain assessment tool 0 to 10. Observe surgical sites or wound for redness, swelling, drainage, oozing, offensive odor. Administer analgesia as prescribed and record on the pain assessment chart. Reassess Mrs. J pain score 20 to 30 minutes after drug administration using the same pain assessment tool and document. If pain relief is ineffective, escalate to nurse in charge, doctors and pain team, and if appropriate, using the appropriate SBA. Inform and reassure Mrs. J of a plan of care. Offer alternative management of pain such as position change, relaxation, TENS, and provide literature to support education. Promote Mrs. J knowledge and understanding of a treatment plan. Offer time to speak to relatives when required. Document all care as planned. Then the self-care will be Mrs. J and a nurse of kin verbalizes their understanding of a plan of care. Mrs. J verbalizes that she understands the pain assessment tool using the scoring 0 to 10. Mrs. J demonstrates the use of call bell when she requires analgesia. Mrs. J verbalizes that she understands the education. Mrs. J will actively participate in a care plan. Then you print your name, sign, and dates. Care plan, fall or impaired mobility or risk for fall. Nursing problem. Mrs. J is at risk for fall due to impaired mobility. Aims of care. To reduce the risk of Mrs. J falling. Re-evaluation of care. To be evaluated each shift or if a clinical condition changes. Care by nurses. Explain and discuss aspects of care to Mrs. J and gain consent for all interventions. Complete a full assessment within 6 hours of admission. Assess for the need of one-to-one nursing care. Give Mrs. J and her family a copy of the leaflet on preventing falls made by the hospital, giving them time to ask any questions. Ensure Mrs. J has footwear or slippers socks on when mobilizing. Place call bell within reach for assistance. Refer to occupational therapists or physiotherapists for rehabilitation. Assess home condition and family relations in mobility assistance prior to discharge. Educate patient and family importance of assistance at home to prevent falls. Inform and reassure Mrs. J of a plan of care. Promote Mrs. J knowledge and understanding of a treatment plan. Offer time to speak to relatives when required. Document all care as planned. The self-care will be Mrs. J and a nurse of kin verbalizes the understanding of a plan of care. Mrs. J verbalizes that she understands to use a call bell when she requires assistance in mobilizing. Mrs. J states that she gains confidence to increase her mobility through support from physiotherapy inputs daily. Mrs. J and her family would identify the support that will be needed to facilitate a safe discharge. Mrs. J verbalizes that she understands the education given. Mrs. J will actively participate in a plan of care. Shortness of breath, care plan, shortness of breath, asthma or cardiac patients. Nursing problem. Mrs. J is experiencing shortness of breath due to asthma. Aim of care. Mrs. J will have a respiratory rate of 12 to 20 breaths per minute and a breathing to be normal in depth and pattern. The evaluation of care to be evaluated every 30 minutes if each shift or if a clinical condition changes. Care by nurses. Explain and discuss aspects of care to Mrs. J and gain consent for all intervention. Monitor and record vital signs, especially respirations and oxygen saturation. Auscultate lungs for breath sound. Measure the peak expiratory flow pre and post medication. Administer oxygen as prescribed. Check the MR for due nebulization to be administered as prescribed. Observe for signs of tachypnea, respirations below 12, prolonged capillary refill time. Report to the nurse in charge, physiotherapists and consultants. If new score is 5 or above, inform nurse in charge, physiotherapists and consultants, and review observations every 15 minutes. Refer to physiotherapists if needed. Ensure Mrs. J is in a condition to allow for maximum chest expansion. Encourage deep breathing exercises. Promote Mrs. J knowledge and understanding of a treatment plan. Offer time to speak to relatives when required. Document all care as planned. Self-care. Mrs. J and a nurse of kin verbalizes their understanding of a plan of care. Mrs. J verbalizes that she understands to use a call bell when she requires assistance. Mrs. J states that she understands the need for deep breathing exercises and proper positioning. Mrs. J states that she will be involved in physiotherapy plan and setting targets. Mrs. J demonstrates correct use of peak flow meter. Mrs. J identifies allergens that precipitate an attack. Mrs. J demonstrates that she is able to administer her nebulizers and record her peak flow pre and post medication. As per hospital policy, Mrs. J verbalizes that she understands the education given. Mrs. J will actively participate in her care of plan. Print your name, signature, and dates. Thanks for watching Planning Stage. Kindly subscribe for more videos and watch out for the remaining APIE and skills. I'll be uploading more as the day goes by. Kindly share this video among your friends and other nurses preparing for the OSCE exam.